on Tuesday to ensure operational readiness of COVID-dedicated facilities with specific focus on oxygen plants, ventilators, logistics and human resources. Nasal vaccine has been finally given approval by the Health Ministry as well. It is a heterogeneous vaccine. As we are learning, even if you have taken a different vaccine, you can take this vaccine as a precautionary dose. The Union Health Minister will be going to one of the hospitals in Delhi on Tuesday to begin this mock drill. So clearly, the Health Ministry ensuring that all measures are adopted to sort of ensure there is adequate preparedness as far as hospital beds, ventilators, and other health and medical infrastructure is concerned. For more details, let's quickly go across to Nikhil, who's joining me on the phone line. Nikhil, important to talk about what can one expect from this drill. Will this give a sort of reality check to the existing medical infrastructure? And also tell us more about this new nasal vaccine.
So, Akansha, this is the breaking piece of information which is coming through the highly placed sources inside the Health Ministry. And now the nasal vaccine has been given the approval by the Union Health Minister. And we have been told by the highly placed sources that it is the heterogeneous vaccine. Even if we have taken some different kind of vaccine earlier, now this is the nasal vaccine which has been prepared by Bharat Biotech, and it will be available for all the people as a precautionary dose. So one thing is this, and another, as far as the mock drill is concerned, we have been informed through the sources that on Tuesday, Union Health Minister, that is Mansukh Mandavia, he is expected to visit to one of the health facilities in the national capital Delhi to see mock drill himself. He is also going to see the preparedness of the hospitals in the national capital. Also, Akansha, if you remember, yesterday this was the big meeting which was chaired by Prime Minister Narendra Modi over the preparation of the COVID as far as the new variant BS7 is concerned in the entire country. And also we have been told that Union Health Minister today at some time he is expected to address state health ministers as well. So these are the crucial meetings which have been lined up today. But on Tuesday, we are getting to know that he will visit one of the facilities where the mock drill.
And you know, this entire drill being conducted by the Health Ministry only goes on to say how adequately India seems to have been prepared, and there seems to be enough medical infrastructure to sustain the country in case there is yet another surge in the nation, which doesn't seem like a scenario in the days to come. But having said that, it's important to also compare why there's been a panic situation in China, which doesn't seem to be applicable to India at the moment.
Well, Akansha, as far as China is concerned, if you remember, since last 2 years, since the COVID pandemic actually started, since that time, no direct flights have been coming in all the way from China. So any of the passenger who is coming from China is not coming directly. Some way or the other, he is coming through another country. So there is no direct flight. So this is one of the reasons why we as a nation need not to panic so far. So this is the reason yesterday as well, while speaking to CNN News 18, Dr. Naresh Trehan, who is the chairman of Ranta Hospital in Gurugram, he said that we have to maintain all the hygienes, all the protocols that were mentioned since the start of the COVID pandemic. So if we are following those guidelines issued by the government, in fact, yesterday as well, AIIMS has issued certain guidelines which says that we have to wash our hands, we have to maintain the social distancing, we have to wear the mask in the public places. So we basically have to follow everything that was given to us. So there is no need of panic so far. But if we are going to continue with all the adequate protocols that we were told earlier, then the health authorities are also expecting that the situation will remain stable. But we have to see our preparedness as well. Remember, during the second COVID wave, Akansha, we have seen how there was shortage of oxygen. But now we have enough oxygen. We have maintained plants as well. Many of the plants, many of the hospitals as well have been given with this installation of the oxygen plant. And in fact, in the small districts as well, the transportation of the oxygen has been ensured by the Union Health Minister. But now there is no situation of panic so far, is what the health officials have been telling us. But at the same time, we have to maintain the protocols because, the festivals are around the corner on